everyone. Greetings, everybody. I'm Pooja from the beautiful Spotless Skin team, and I'm here to welcome you to this amazing Instagram live session where we're going to be talking and debunking a lot of myths around acne and its management. Acne clearly is a condition that is affecting millions of people worldwide. But trust me, acne isn't just a surface issue. It can deeply impact one's emotional well being. And beyond the physical blemishes that you really get on your skin, it can really lead to someone's self confidence being hampered, can lead you to anxiety, depression, and even social withdrawal in some cases. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are widespread misconceptions around acne and its management. Today, we're going to have this live session where we will be talking a lot around how can you really manage your acne in your daily life to empower you and have this beautiful skin that you really are dreaming of. This session clearly promises you to get all that information at your doorstep. Today, we are diving into the topic of acne management with our skin expert. And whether you're struggling yourself with breakouts or simply want to learn how can you maintain a clear skin, this session will clearly give you all the information you need. Today, we are honored to introduce Dr. Meenal Mittal, a renowned skin expert from Aligarh. Dr. Meenal is a highly respected dermatologist with more than a decade of experience. She's based in Aligarh and she's renowned for her expertise in dermatology, trichology, and aesthetic dermatology. Dr. Mittal is committed to providing ethical and skillful care. She's specializing in a wide range of skin conditions such as psoriasis, vitiligo, and hair loss treatments. She excels in advanced cosmetic procedures, including facial rejuvenations, lasers, Botox, and fillers. Clearly, a lot that we've been talking about these days, but it's all that Dr. Meenal Mittal takes care of. Her comprehensive approach ensures that patients receive personalized treatment tailored to their unique needs, and that's what is special. It makes her a trusted choice for both medical and aesthetical dermatological care. Today, we are privileged to have her with us, and she will be sharing insights on acne and its management. We extend a heartfelt gratitude to you, Doctor, for joining us. Thank you very much for being with us at the beautiful Spotless Skin team.
Thank you so much for a kind introduction. And today we will discuss in short about the acne and its management part. We'll take some questions also in the last, and we'll say I'll also share some take-home messages which will help you to take care of your skin at home. What all you can do in daily life, a simple face care. Just
Absolutely,
about
Doctor.
uh,
So, with
and So we'll start with what is acne. First of all, what is acne? Acne vulgaris is a chronic inflammatory condition that mainly involves the pilosebaceous units that includes the hair follicles, the sebaceous glands, the oil glands of our face. They, along with the hair follicles and the hair, they constitute the pilosebaceous unit. This when this is involved, there is inflammation in this pilosebaceous unit, and there is excessive secretion of the sebum from the sebaceous gland in the pilosebaceous unit. There is development of acne or bumps or zits or breakouts. In common terms we can call breakouts. So this is a common problem, especially in teenage. It mostly occurs in the adolescent age group and may be diagnosed in 75 to 80% of all the teenagers between the ages of 10 to 16 years in both the sexes, whether a male or a female. It is common in both the sexes. And acne, usually it occurs at a younger age in females. That may be because of the early onset of the puberty. It occurs at an earlier age in the females, but it can occur in both males and females in the teenage. It is most in the teenage. Sometimes there is adolescent acne also, which may be persistent from the teenage, or there is late onset acne also, which is more common in females. That is also more common in females. The adolescent acne and the persistent one, or maybe uh, the late onset one, they are mostly associated with some hormonal causes, especially in females. They can be associated with some hormonal causes. And sometimes there is with acne there are other associations also, like there is seborrhea. If you have a oily scalp, if you have a oily skin, there is varying degrees of dandruff. Sometimes people also complain we have a lot of dandruff or itchy scalp. And there is associated breakouts on the face. So there is associated varying degrees of seborrhea or dandruff, or oily scalp or itchy scalp also, with acne vulgaris. The most common sites of acne are the face, can involve the face, the chest, the back, upper arm. Sometimes it can also occur on the upper arm area, but most common sites are the face, chest, and the back, and for acne.
So, doctor, you mentioned that different kinds of acne come at different parts of your body. So, does it mean that specific areas where we get acne is also because of a specific reason?
Yes, sometimes, as I discussed about the hormonal causes of acne, mainly because of the PCOS or some other hormonal causes, like because of the any adrenal causes or the ovarian causes also. When there is acne in this area, the jawline area, this acne is mostly because of the hormonal causes. And if there is acne in the mid facial region, this T zone area, this mid facial region, if there is acne, this is mostly a comedonal acne. The acne lesions are of two types. They are inflammatory also and non-inflammatory also. The non-inflammatory ones are the comedones, the blackheads or the open comedones, and the whiteheads or the closed comedones. That is mainly because of the accumulation of the keratin within the pilosebaceous unit. When it is visible on the skin, it is called the open comedones. When it is not visible, that is the closed comedones. So, when there is a distribution of comedonal acne, mainly in the mid facial region, in the T zone area, then it has got a poor prognosis also, and it takes a prolonged period to and a prolonged course of disease and prolonged treatment period also. And when there is acne in the, sometimes we have seen there in teenagers especially, there is very small minute papules, or you can say whiteheads on this forehead area. This is mainly the sandpaper comedone, we can also say. They are mainly in the teenagers. In the young age, there is eruption of the non-inflammatory lesions over the forehead. And sometimes, and if there is in this temporal area, if there are more of acne, pustular lesions, or comedonal acne in the temporal area, it can also be because of the hair products. If the hair products we are using, they are so thick hair products, or oil, thick hair oils like mustard oil, coconut oil. If the patient has the tendency to use hair oil regularly, or and to leave the hair oils for a long period of duration, and so they have a tendency to develop the acne in this area, temporal area, or maybe forehead. They develop this acne. So the various areas of presentation of acne may denote the different causes of acne.
Okay. So, doctor, I've also read about different grades of acne. So, does that also mean something?
Yes, there are different grades of acne. The most they are comedonal acne, as I've discussed. When there are only white heads or black heads present, that is the comedonal acne. These are the non-inflammatory lesions of the acne. Then there are mild, moderate, and severe grades of. In mild acne, there is mixed form, in which there are more of comedonal acne and less of this inflammatory lesions of the acne, the papules, the pustules, or nodules. They are less as compared to the comedonal acne. This is the mild grade of acne. Then the moderate, it is also mixed type, but it has predominantly papulopustular lesions. So that is the moderate type of acne. And then there is the most severe grade of acne, which includes the nodules, cysts, or maybe the sinuses or tract formation. It is the most severe form of acne. Sometimes there is it can also progress to acne systemic, in which there are features of like body pain, joint pain, or their fever, arthralgia, or other symptoms also that are included in the severe type, severe grade of acne. When there is nodules or cysts develop on the face, there are the stubborn type of acne, which may not go just with the amp- uh, typical management for acne. You have to uh, do some procedures also for that. That is the most severe grade of acne, in
So,
which there are
doctor, you
systemic.
sorry, doctor, so you just mentioned about the severe grade of acne. So how should our viewers really understand which one is a severe acne? Is it like the prolonged acne being there, or it's just looking very different? What exactly can help them define that this is a systemic acne?
The severe form of acne, the acne lesions are very stubborn. If you are on treatment for a prolonged period, and then also there is no relief, and the lesions are deep seated inflammation. There is more of redness, more lesions are more of painful also. They are large also. Sometimes nodules or cystic lesions are also present on the jaw area, or maybe the cheek area. The cystic lesions are also present, the fluctuating ones. These are the indication of the severe form of acne, and should the patient should not go for any home treatment or self treatment. In such cases, you must report to a doctor immediately, because there are more chances of acne scarring also, and PIH also after severe grade of acne. Once there is scarring, there is no medical treatment can reverse the scarring. So it is important to get a prompt treatment if there is severe grade of acne.
Absolutely. And this is my advice to the viewers. If you're getting an acne which doesn't look a very normal acne and it's staying for very long, and as doctor mentioned, please do reach out to your doctors. Don't take it lightly that it's just an acne. It's probably a sign of something that is really serious in your body. Thank you very much, doctor, for highlighting that. But, doctor, imagine if we have these different types of acne, different grades of acne. When is it that, our viewers should really go ahead with the treatment, and what are those treatments like?
So the basic treatment may be for mild to moderate grade of acne. The topical treatments also, there are different treatments like retinol, benzoyl peroxide, many antibiotic topical antibiotics also, other antibiotics, microbials also are, but that all we can use only after the advice from your doctor. But the mild to moderate grade of acne can be treated with the topical medications and some oral also. But the severe form, in which there is nodules and cysts are also present, so oral treatment along with the topical is must. Some other procedures like intralesional therapies like triamcinolone can be given for nodules, cysts, and these are the procedural treatments that can be given. The chemical peels can also be done for the active form of acne or the severe form of acne. Peels can also be done. Then there photodynamic therapy or pulse light therapy that can be done for the severe form of acne. And sometimes there are when there is comedonal acne, when there are only whiteheads or blackheads present over the face, the most common procedure we can do is we can do comedone extraction also. That instrument we can use to extract the uh, comedones, and we'll give a barrier repair cream, and that can heal the post-inflammatory redness and everything. So these are all the procedures that can be done if there is active acne or comedonal acne, besides the usual topical and oral treatment for available for acne.
Right. So, doctor, there are multiple treatments as I hear from you, but does this really increase sensitivity towards the skin if we undergo such treatments, or what is it like, please?
Okay. Definitely, there is some form of sensitivity after the procedures, but when you are taking care of the skin according to the doctor's advice, like using a sunscreen, a mild cleanser, or some products advised by the doctor, or moisturizer, mild lightweight moisturizer that good for acne-prone skin. If you are using the care as advised by the doctor, then it is okay. there is no downtime after the procedures, and they are safe for the patients.
Okay, doctor, there's a question coming from in the chat window from Firoz, and I remember growing up with this sort of question: that does touching your face cause acne?
Not usually touching, but scratching. If there is acne or if there are any comedones on the face, if you are scratching them, then it can precipitate the acne all over your. If there is acne and you are scratching it, and there are increased chances of scarring, also increased chances of PIH. Or sometimes there are patients who also come. There is a type of acne called acne exporre. They scratch the lesions of the acne. So there are erosions present all over the face. Instead of the comedonal or papular pustular lesions, there are erosions present all over the face. Maybe because the patient has scratched the lesion. So it is it is advised to avoid strictly avoid scratching or scratching the lesions or doing any. People also use some home remedies to cure acne. Sometimes they are useful, but sometimes they may cause harm also, because they irritate your skin. They irritate. We, they have no idea कि this will work or not. So they use it in excess, and they cause irritation to the skin, which in turn leads to more of excess of oil production on the face, and more of this
Yeah.
irritation may lead to more production. So it
Yes.
is advised to avoid the home remedies also in such cases.
Absolutely. Doctor, another follow up question that came to my mind because I remember when my mom used to say that, oh, you're actually touching your face throughout the day, which is why you're getting acne. And then we had this, very irritated feeling that we want to prick the acne. And I remember my mom telling me to not do it. And then we used to go to the salon to actually get it removed because they used to do it. So, what exactly is right? Going to the salon, getting it removed is the right thing? Or, what should we really do when we have an acne that's staying for really long?
Okay. If there are only occasionally one or two eruptions, one or two breakouts, then it is okay. You are doing something at home, or maybe asking someone to pop them out. But if there are recurrent eruptions and there is more of inflammation, more of redness, and some pustular lesions are also coming in your face, then it is strictly advised to consult your doctor, because early treatment can prevent scarring on your face, can prevent PIH, chances of spots on your face. Because ultimately, if you have PIH and scarring on your face, you have to undergo procedural treatment, because after once there is scarring, we cannot give any medicines, any oral or any topical medicines. So uh, once there is, if there is inflammation and there are recurrent eruptions, multiple eruptions over the face, it is advised to go.
Clearly. So no to pricking, right? No
No to.
pricking the acne. Clearly. All right, Firozji, I hope you got your answer to the question. We've got multiple questions coming in the chat window. The next one is from Rohit, and I think it's a nice question. Can tight clothing lead to body acne?
If there is synthetic clothing, sometimes the people wear synthetic clothing also, in which there is uh, more occlusion, that can cause occlusion of our oil, especially in the chest area, back area, the upper arm. If any type of clothing can cause occlusion of the oil glands of the sebaceous glands in the area, then it can, because of excessive sweating, excessive collection of sebum uh, in the pilosebaceous unit, there is there are chances of getting acne over the chest, over the back, over the upper arm area. So it is strictly advised to not wear occlusive clothing, especially synthetic clothing, in where there are more chances of uh, getting sweat, or uh, more chances of.
Right. So, Rohit, there is a connection between tight clothing and having sweat, and then, of course, leading to body acne. So, maybe try and avoiding it very frequently is what we can say. Another question from Abhi Kumar, and he says, does acne worsen in hot climates?
Yes,
Because again of the
definitely.
sweat, I
Uh,
guess.
acne worsens in hot climate, mainly because when there is more of uh, in hot climate, when there is more of sweating on your face, it will there more of dirt or sebum on your face. It gets collected in your in the sebaceous or the follicle, and it can clog the pores of the face. This will lead to more of acne, more of inflammation, more growth of the bacteria, the propionobacterium bacteria that causes the inflammation in the pilosebaceous. So that the hot and humid climate can increase the growth of the propionobacterium, and that can lead to the acne, more production of acne on the face or maybe the chest of the face. So uh, hot and humid climate can lead to more production.
So obviously, doctor, we can't avoid the hot climate, understanding the northern India specifically. So what are the preventive measures that we can take during a hot climate to protect our skin? Just sunscreen and stuff?
If we are living in an area where the temperature is high or maybe the humidity is high, so what we can do is we can use some AHA BHA based face washes like salicylic acid based face washes, or maybe the uh, uh, glycolic acid based face washes or mantelic acid based face washes we can use. So what we can do is we can use salicylic acid based or glycolic acid based face washes, so that we can use them at least twice in a day, so that when there is excess dirt or sebum present on our face, that can get cleansed, and we can use a moisturizer post face wash. Sometimes we also think that if we have a oily skin, we have a hot climate, we have excess of sweating, we do not require a, but it is must to use a, that you can use with the advice of your doctor, or a lightweight or water based moisturizer we can use. If we can if we are not in contact with the doctor, we can use a water based or lightweight moisturizer that can will which will not clog the pores, and but will provide the sufficient moisturization which is required for the skin, and will not cause the barrier damage. Sometimes the salicylic acid or glycolic acid based face washes, they may also cause excessive dryness on our face, that can lead to the barrier damage, the skin damage on the face, and can cause sensitivity to the skin. So after every face wash, we can use a lightweight or water-based moisturizer. And if the temperature if we are working outdoors also, so then it is also important to use sunscreen. Especially 30 to 50 SPF sunscreens are sufficient for the uses, and that also the water-based or gel-based sunscreens can be used. And other measures that we can take if we are living in a hot and humid climate are that if we can make a routine to wash our hairs every alternate. If you have oily scalp, you can also wash your hair every day. Otherwise, you can wash your head every alternate day with a mild shampoo with salicylic acid, with SLS and paraben free shampoos. We can use them every alternate day. So sometimes when there is oily scalp and there is excess of sweat or excess of dirt, or there is oil in the scalp, that may also precipitate the acne on the face. So make sure to wash your head also every alternate day with a mild shampoo that may not cause excessive dryness to your head also. So these are the things that we can follow if we are living in a hot humid.
Clearly, so hygiene has got a big role to play, especially with the hot climate, right? From keeping your hair clean to your skin pretty clean, no, excessive sweat, no dirt. So, Abhi Kumar, I hope you got your answer. Doctor, another question, very, very interesting from Kiara, and she is asking, can emotional stress also trigger acne?
Yes, yes, emotional stress can also trigger acne. Sometimes because emotional stress can lead to the hormonal imbalances, especially in females. It can lead to some hormonal imbalances, and which may, in turn, the hormonal imbalances, like in PCOS, there is excess of androgen production, which is a male hormone. when there is excess androgen that stimulates the hair follicle, the sebaceous glands to secrete excess of sebum in the hair follicle in the sebaceous. And then there is clogging of the pores. So yes, definitely, if there is stress and there is hormonal imbalances, they can lead to increased production, increased breakouts on the face.
Okay, fair enough, doctor. So, keeping your mental well being is also essential to have a clear skin, very clearly. Another question from Kapil. He says, how to manage whiteheads? And I personally have that question. Like, despite cleaning, despite scrubbing probably once in a week, we do have whiteheads when we're stepping out. So, how can we really deal with that, doctor?
Okay, as I've discussed, a regular use of a face wash is necessary if you have whiteheads or microcomedones over the face. Then a regular use of salicylic acid based, galactic acid based face washes along with uh, post face wash, you can use a moisturizer after that. But otherwise, if you can visit a doctor's clinic, you can get them removed also. The whiteheads and the blackheads can be removed with a comedone extractor that your doctor will advise you how to manage it after that also. And you can go and consult your doctor, and you can get them removed also. If there are so many of, and it disturbing your mental well-being and disturbing your um, uh, uh, thinking and everything, you can go and get them removed. Fine.
Okay. Right, and this is clearly my personal experience also. I think going to a salon, getting your whitehead removals, they're not very trained, I personally feel. And I remember getting the whiteheads removed from my doctor, and I think that was quite an effective treatment. So I would also advise that, versus going to a salon, I would suggest go to your doctors because they are more trained and, to get something correctly done for you and your skin. So thank you very much, doctor, to highlight about whiteheads. There's another question from Ria, and she says, can acne really come up in the shoulder area? Does it affect the shoulder area?
Yes, acne can also occur in the chest, the shoulder area, the upper arms can also occur on the back area. Sometimes there are medicines also, like there are oral, if a patient is on for any other reason the patient is on oral corticosteroids or some other medications also, they can precipitate acne. There are acneiform eruptions maybe on the face, chest, shoulders, upper back. Though they are acneiform eruptions, they are more of papillopustular lesions and less of comedones when they are mainly because of any drugs or any other any because of corticosteroids or maybe because of any other drugs. They are mainly the papillopustular or inflammatory type of acne, and they are less of the comedonal acne, but they can occur over the chest back area. Usually, also there is truncal acne also. Likewise there is face acne or acne vulgaris. There is a truncal acne also that occurs on the chest area, the back area, upper arm, shoulder area. That is truncal acne. So we can get there are chances of getting truncal acne, especially if you're working in hot and humid climate. There are more chances of getting truncal acne.
Okay. So clearly, acne on the body also can have multiple reasons, as you said, doctor. I really didn't know. And focusing on which body part are you getting the acne can really tell you a lot about it. So do take good care of yourself, Ria, if you've faced acne around your shoulder area, as well as doctor mentioned. Doctor, I also feel that I'm not only feel, I've also read that what you eat is what you are, and does diet really play a major role in acne coming up, and what sort of diet can really worsen or improve the acne?
The role, yes, the role of diet in acne cannot be ignored. It is very important. The what you are taking, what you are eating, it is very important. If you are getting acne, it is very important to to keep a track of your diet and everything, your lifestyle. If you are getting acne, especially if you are having any hormonal imbalances, any polycystic ovarian condition. So it is very important to keep a track of your diet, of your workout, of your lifestyle and everything. So like there are many uh, diets, like if there is high sugary diet or the diet with high glycemic index, and the diets with sometimes the people there's more of dairy product intake in the diet of the patients. So all these things can precipitate the increase the chances of getting acne. In the If there is high glycemic index of the food, like high sugary diet of teenagers, especially adolescent age females and males, they are if they're more inclined towards the diet like ice creams, chocolates, and more of sugary diets like candies and everything, they have a high glycemic index. And this high glycemic index can lead to the increase of the insulin like growth factors. And when there is increased insulin like growth factor, it can lead to hyperkeratinization of the pilosebaceous unit. And there is more accumulation of keratin in the pilosebaceous unit and around the hair follicles. And there are more development of acne. So there are more chances of getting acne in such cases. And sometimes dairy products also can lead to increased production of increase in the diet of um, if there is increased intake of dairy products in the diet, then increased chances of getting acne. And so it is important to there is role of probiotics also. So if you are taking good probiotics in your diet, that can help to improve acne. Like if you're taking curd, yogurt, these are like good probiotics which you can include in your diet that may prevent from getting acne. But the probiotics with high sugar content that are easily available in the market, easy you can get them easily with the any confectionery shops or anything. But they are with the probiotics with high sugary content, they are must a no. They should be avoided. And good probiotics can be included in the diet to improve acne. If you have more of acne, then these can be included. And there are life importance of lifestyle changes also, like a regular workout or regular exercises, whatever we can do. It is not like कि हमें जिम जाना है या मतलब वही सब कुछ करना है, मतलब जिम जाना है ये सब चीजें करनी है, बट कुछ भी जो भी आप कर सकते हो, लाइक रेगुलर वर्कआउट, एक रेगुलर एक्सरसाइजेस या वॉकिंग, ब्रिस्क वॉक, और एनीथिंग जो भी आप, डांसिंग, एनीथिंग जो भी आपको कंफर्टेबल हो, बट एनीथिंग यू हैव टू डू to and this all these lifestyle changes can bring a good harmony in the if there is any hormonal imbalances. So this all we can do.
डॉक्टर वेरी बेसिक क्वेश्चन, क्योंकि आपका फोकस डेयरी प्रोडक्ट्स पर था एंड आई वाज जस्ट थिंकिंग अबाउट इट दैट आर इंडियन होम्स, यू नो, वी आर यूज्ड टू हैविंग आवर दूध वाली चाय एवरी डे, राइट? वी डोंट हैव ब्लैक टीज एंड ब्लैक कॉफी, सो कहीं ना कहीं हमारा डेयरी इनटेक थोड़ा सा ज्यादा एज कम्पेयर टू probably people in the foreign nationalities. And also like as vegetarians or even you know, the eggetarians, उनके यहाँ पे the breakfast में there's egg or there's a portion of you know, paneer or something in our daily meal. So does that also count for excess dairy, like 2 cups of a tea and a bowl of paneer, or some eggs in a day? What is excess?
Like if you have excess of intake, then we can cut short some things. It is not like we cannot take dairy product, we can take
Yeah.
dairy product. But if there is acne, more of very severe acne, then we can
Yeah.
cut short some dairy products in our diet, especially milk.
Okay.
For some cheese products, milk products, we
Okay.
can avoid for some time, or we can cut short.
Okay.
Quantity wise we can cut.
Okay. So clearly, when acne comes in, that's when we look at all these aspects also if they're contributing to acne. And that's when we can decide that the dairy product intake also is something that could be triggering. Fair enough, doctor. Another question that I had is, what should we really do for a daily skincare? Like, we understand we need to use moisturizer, sunscreen, XYZ. What is that daily skincare routine that our viewers can follow to have this clear skin that they're really dreaming for having?
If you have oily skin, you can use, if you have more of oily skin, you can use salicylic acid, lactic acid based face products. But if you have more of sensitive skin and there is
Yeah.
more chances of getting dryness or redness after using any active face washes, then you
Hmm.
can use a mild cleansers. They are also available. Mild cleansers like cetyl alcohol cleansers can be used regularly twice daily. If you have a sensitive or a dry skin, these can be used along with followed with the application of a water-based moisturizers and a sunscreen, gel-based sunscreen or water-based sunscreens of SPF 30 to 50 SPF can be included in your daily routine. And especially if you have acne, then the more it is preferred to use a non-comedogenic, and uh, the sunscreen, especially for the acne-prone skins, can be used with PA triple plus rating. Can be these are can be included in your daily skincare. And sometimes people also ask about the toners or the astringents to be used on the face. But I usually do not recommend the use of toners or astringents on the face because, like we discussed, they can cause dryness on the face. They can irritate your. Sometimes they can irritate your skin, especially if you have acne prone skin. They can irritate your. It can lead to more production of acne on your face. So uh, it is uh, it is advised to avoid the use of the toners or stringents, especially if you have a acne prone skin. Until unless it is advised by your doctor, you have to avoid stringents. All you can do is a mild cleanser, a moisturizer, a sunscreen. At night time, sometimes people have also fond of using the serums at night that
Yes.
you can use, like niacinamide serum can be used at night. But that too, if you take proper advice from your doctor, then it is beneficial. It is more beneficial if you take a proper product as advised by your doctor. And all this is simple. Sometimes people are there very like कि हमें ये भी यूज करना है वो भी यूज करना है, बहुत सारी चीजें यूज करते हैं फेस पे, इतना सारा यूज करते हैं that it can it make you, when they're using so many things on the face ना, तो वो that it will clog the pores of the hair
Yeah.
follicle. That clogging will lead to more of it. So
Yeah.
it is advised to use a simple day skincare routine.
Yes, absolutely. And I think I'm loving this that the doctors are making the skincare really easy for you. Let's not complicate our skin. Less is the more, that how we say. So make sure you're not complicating your skin with over-the-counter treatments. I know there are multiple serums out there and you all want to spend and have that beautiful skin. But beautiful skin can be achieved by simple things, as Dr. rightly said. And Doctor, my last question to you, of course, because in this Instagram generation, we all want to look beautiful, we all want to have makeup on. Can makeup really worsen acne?
Yes. In that case, makeup can worsen your acne if you're using a thick or oily or oil-based makeups. If you have, if you are using cosmetics, you can use them, but it is important to wash your face before going to bed. If you're washing your makeup before going to bed with a proper cleanser and face wash followed by a moisturizer routine, proper routine if you're following after uh, washing the cosmetics from your face, then you can use cosmetics and light you can say water based cosmetics or water based foundations, or that gel based foundations we can use instead of using the thick or oily or foundations and the thick moisturizers that can clog the pores. So that could be avoided. Otherwise cosmetics can be used, the water based or light based cosmetics can be used. And make sure to wash your face before going to bed, so that can prevent many skin problems on your face.
Clearly. So we're not saying no to makeup, but we're just saying that ensure that you keep your skin clean, get your makeup off really well before you go to bed. Use the right foundation and makeup that doesn't really clog your pores. So be very careful with the cosmetics that you're really choosing. And I think with that, we've discussed a lot about acne, doctor. But is there anything else that you want to add on in your closure before we end this live session?
Okay, as we have discussed most of the points, but in short, I'll also give you a about the hormonal acne. If there is hormonal acne in females, the line of treatment is a little different. If you have any hormonal imbalances, if there are any irregular cycles, and along with the increased hair, sometimes females also have some increased hair of the body or face, the androgen depend this area. If there is increased hair growth and there are irregularities in the cycles, so it is important for you to take a prompt treatment from your dermatologist or your doctor. So there are some investigation, the blood investigations also, the scans also that are to be. So it is important to take a timely treatment so that the condition will not can be controlled at that time, and you there are less chances of getting the scars and PI over your face. And if they are in hormonal imbalances, there are more chances of getting hair fall also. So
Yeah.
use mild shampoos or mild acidus free or paraben shampoos that can so that there is uh, less chances of getting that excessive hair.
Clearly. So I think with that, my female viewers, you've got enough insights about hormonal acne also. And there are times when you can't really identify whether it is a hormonal acne or just a routine acne. So please reach out to your doctors if you're feeling there's anything irregular. But with that, it's a wrap for us. Thank you very much, Dr. Meenal, for your valuable time. It's clearly been a super informative and an engaging session for me and my viewers. It was great to hear you, and we look forward for many more such sessions with our viewers going forward. And thank you very much, all the viewers, for your participation. Stay engaged on our page and stay connected with our beautiful Spotless Skin page. With that, thank you very much. See you soon.
Okay, thank you so much for making part of this podcast.